So recently, we all know that Donald President Donald Trump stopped financial aid to most of the African countries, and African leaders are kind of worried about this particular issue about Donald Trump stopping to give them financial aid. Okay, and most people will be like, why are they worried about this financial aid? Why this country, Africa, majority of the African country has its own natural resources which can actually provide them the money that they need in order to cater for their citizens. Okay, guys, welcome back. Today's video is all about financial aid, because this financial aid that Trump stopped actually made a lot of people realize that it's not just only that our leaders are getting money from the natural resources that we have, okay, in African country or in Nigeria in particular. Rather, they also get financial aid from America, Western worlds, to also support most of these health issues. Okay, so now that Trump has stopped it, we already know how Africans, a lot of people were worried about it, talking about it, and all that. But today, let's talk about Nigeria. I'm here to talk about Nigeria. This is one of the things that they used to say when they say, may Nigeria never happen to you. It will be like is a curse, or it will be like, what is it in Nigeria that they usually say, may Nigeria never happen to you? Now let's go. When most times we come here and talk about Nigeria, Nigeria needs a long way to go. It will be like we talk too much, we complain too much. Now, you guys, I stand on this video which is trending on social media, and honestly speaking, this video, I I feel so bad bringing this video here, but at the same time, I have to bring this video here. Do you know why? Let's watch, and then you will get all of us will get to conclude together, because it's not me that is concluding. Let's start with this video of one of our Nigeria content creator talking about why are African leaders, Africans, worried about the financial aid that Trump stops. After that, I'll get to the next video, and this one in particular is all about Nigeria. You will know that even Nigeria itself, not just African that is worried, even self is Nigeria. Go 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 go. The other African countries have left this level that I'm about to review in this particular video.
Why are they worried about Trump effects in Africa? I mean, the African leaders, why are they so agitated? Why are they worried? Why are they scared? Why are they panicking that, oh, Trump is cutting foreign aid to Nigeria or to Africa? Anyway, let me explain. Now, because of this, I love what the former Kenyan president said. Listen to him.
People the other day crying, oh, I don't know, Trump has removed money. He said he's not giving us any more money. Watu wanalia. Why are you crying? It's not your government, it's not your country. He has no reason to give you anything. You don't pay taxes in America. He is appealing to his people. Shauri yenu bwana. This is a wake-up call for you to say, okay, what are we going to do to help ourselves? Instead of crying, to support ourselves. Because nobody is going to continue holding out a hand there to give you. It is time for us to use our resources for the right things. We are the ones who are using them for the wrong things.
I'm sure recently you heard that President Trump cut off foreign aids to African countries, especially the medications, the HIV drugs, malaria, and all that. Anyway, that policy has been put on hold. It just paused up. It's not that it has been cancelled. It's just that they have more important things to do. So they just paused down yet. So the medication, everything is still on, the aid is still on. But let's go back. How much has the United States actually spent on foreign aids to Africa? Now let's focus on Nigeria. So far, in the last 10 years, the United States of America has spent at least $7.8 billion on foreign aids to Nigeria. Nigeria alone. The question is that, what has the Nigerian government done with that money? In fact, let me even give you a breakdown on how they received that money yearly. In 2015, the Nigerian government received $489 million on foreign aids. That is, include the drugs, the malaria support, the HIV drug support, the flood victim support, all those things. During the transition between Buhari and Jonathan, that period, Nigeria was going through a lot and whatever, the insecurity. So Nigeria received $446 million.
This is where women give birth. That's the toilet. This is where people give birth. In this primary healthcare center, this is the only forceps in this entire place. They don't have more than this. When women come at night to give birth and there's no light in the hospital, how do you take their deliveries?
Well, you're just using our phone, touchlight.
You're using the touchlight of your phone to take the deliveries.
Yeah.
What if there's bleeding? How do you know where it's bleeding? Have you seen the problem that we're facing in this country? That is the electricity that is powering this entire hospital. If your leader is not serious about the primary healthcare center, they are wasting their time. Because the primary healthcare center is the first level of healthcare in any country, any state, any local government that is serious about healthcare. This hospital does not even have adequate solar care. There's no lights. There are women who give birth in these hospitals. You can see what the labor room looks like. There are people who are going to need wound care. You can see what the wards look like. There are children who require help from this hospital. You can see what the resources look like. Vaccines have to be imported from another hospital just so that they can be given to the people here. But no worry, you can scroll because this is not bomb or funny or whatever it is. Tell your leaders that they should focus on primary healthcare centers and not be building fake ultra-modern hospitals everywhere when this is neglected, because everybody everywhere actually deserves access to the highest quality care possible.
Single light, there's no light. I saw this video, I was weeping. I was supposed to make this video since last week, but I haven't been chanced enough to do it. Today I am chanced. Like, I was like, this is the millions that they're bringing out every year for healthcare center. For healthcare, they cannot even lend and not even 10% of it. The primary healthcare center that they should be catering for, with all the billions that they collect, they should cater for, take care of. Like, if you cannot take care of the health centers, most villages, this is how it is. I'm not even talking, even the ones that is functioning, just take a look at where it's functioning. Some are not even functioning again. Some grasses has full it. The ones that are functioning is in private. Even anyone that's eventually functioned, that you go there and see things working very well, just know that it's a good Samaritan that lives in the village that decided to invest, that decided to support out of his good heart, to support and make that primary healthcare center to be functioning, to be okay. This is it. And you people say we have governors, we have people that are okay, people that they just, after they will collect billions, trillions, they will just, what are they using it to do? Let me don't just go and mention the one that they will come for me after. What are they using it to do? This is really, really so sad, so unfair. In Nigeria, in this century, where every other countries are doing very well, where healthcare center, health should be the one of their first priorities, their priorities to cater for, to take care of, to invest their money. Is how they live it. This is a lot of them. So this is one of the things that we saying, this Nigeria, we still have a long way to go. Nigeria, long way to go. At this point, I think the best thing to do is individuals do these things. Like, collectively, Nigerians should do it, because if you continue waiting for this government with all the money that they use to call out every year that they will bring out for health and everything, they will do nothing. People will continue to risk their life. They will do nothing. This one self is only healthcare I'm talking about. When we will now go to educational sectors, what are we going to even talk about in that area? Like, nothing. There is nothing to write home about when it comes to this thing. I was literally shivy. I was like, how would women even self kai? If there is emergency, no survivor. If anything happen in this environment, like, no even single light, kai. And we say they used to call billions of money, and you will say Nigeria is good, to talk well about Nigeria, you do this, you complain too much. Oh, guy, complain. Me, I cannot see something that is not good, I will say it's good. I cannot see black, I will call it white. That is just the truth. Because they are not even investing in sector. Most of our doctors are leaving. Most of the good doctors, they are leaving the country. They are traveling out, going to where they will exercise their profession in a very good environment. Honestly, Nigerians will go to Google. Google will tell you a lot of Nigerians have a lot of professional doctors, good doctors, but all of them are japai. They are going to where they can actually do it very well. All the tools that they need in order to practice what they learned is available for them. Honestly, Me, my own is that we should, at this point, there's no need of counting on this ndoshi that we call governments. Ndosha, I think this thing is something that collectively citizens, indigenes need to just come together and do for themselves. Because if not, what is this? Anyway, guys, this is what I say. I say they are angry that they stopped some financial aid. This is why they will sue, because they don't make use of the money. They make use of it in other stuffs, in their own personal life. Besides, their children are not going, their wives are not in this kind of environment. They are in a better place. They don't jabber. They don't care about other people's life. Poor masses. That is one thing about Nigeria. They don't care about poor masses. Imagine a government health center that should be the number one. That should be the one that people will rush to because they are functioning very well. But no, it's the other way around. Anyway, guys, that is it for this video. Don't forget to like. If you see good thing, call it good. If you see bad one, call it bad. Oh, this one now is a no. With all the money that Nigerians bring every year out, trillions. If you see when they are calling it, you'll be like, what is happening? Even though they stopped this financial aid to so many other African countries now, they have left this side, this level of going to different various health centers in the villages or in the state, local governments, and you'll be finding this mess. It's full everywhere. I cannot tell you, even in my village, they there. In fact, grass everywhere. Anyway, guys, that will be it for this video. Don't forget to like, share, and subscribe to my channel, and I'll see you guys in my next video. We'll continue to talk.